Senior pets. Maybe you've heard this phrase before. These days, the way we define seniors is aged 7 years of age or older. More than 7, senior. Now granted, different dogs and different cats live for different ages, but it's a very good rule of thumb. Now, why does it matter? Why do we even care if an animal is considered a senior or not? Well, the reason is because seniors require different steps to be a good guardian. There's different health concerns that happen with seniors. They need to be on special diets. They need to get checked at the vets more frequently. Many times they have certain problems inside that are more common as a pet ages. We see things more commonly. We see arthritis, we see other orthopedic problems, we see the kidneys not doing their job properly, sometimes liver disease, sometimes diabetes. Now here's the interesting thing. In the early stages, we will not necessarily see any signs of these problems. And the reason is because pets will hide their disease. They will mask their disease. I like to call it compensation. That means that the pet will not show signs of the disease. Now, after a certain period of time, when it gets bad enough, then we'll see the drops in appetite, then we'll see the weight loss, then we'll see the changes in thirst or urination or perhaps vomiting, all of the signs of illness, but not necessarily during the early stages. And there's a reason for this. If we go back in time, many thousands of years ago, animals were out in the wild, and if they acted sick, they would get gobbled up by predators because predators usually consume sick animals. Or they would lose their position in the pack. They would lose their status in the pack because the dominant animals are the leaders of the pack, and the weaker, more sickly, or more elderly animals, they are lower in the pack. So it makes sense that animals hide their disease, compensate for it until it gets bad enough, and then they decompensate. So what do we do? What do we do as guardians? What we do is when they start getting more elderly, we start doing blood testing. And we use machines like these so we can find the problems before they get too far advanced. We can find the kidney problems, and we can find the diabetes, and we can find the liver issues, and we can do something about it. We can do special diets, we can do supplements, we can do other steps so that we can make sure that you have the longest and happiest life possible with your pet.